Welcome to another episode of An Inside Look. Today, Choi and I have the opportunity to interview Jillian Palmer, a physiotherapist that runs an extremely unique practice focusing on women's health and rehabilitation of the pelvic floor after pregnancy. She's excited to tell us about how she discovered her professional passion while maintaining an extremely busy lifestyle as a mother of four. Her passion and dedication to women's health is truly inspiring, and I'm excited to hear about her journey. Welcome back to another episode of An Inside Look. Our guest today is Jill Palmer, a physiotherapist with tremendous passion for women's health. Her practice at Bounce Back Physical Therapy focuses on rehabilitation of the pelvic floor and utilizing body's own inherent ability to heal. She's passionate about educating women about their bodies and allowing them to bounce back after pregnancy to step onto the next chapter in their lives. Welcome to our interview, Jillian. Thanks for coming in.
No, thanks for having me. It's great to be here.
So tell us a little bit about yourself.
Okay, I am an alumnus of university. So these are the University of Alberta. These are my old stomping grounds. I graduated in 2008 from my undergrad in honors neuroscience. Then I graduated in 2010 from the Faculty of Rehabilitation Medicine with a master's in physiotherapy. I worked for several years just as a general practitioner, orthopaedic physiotherapist in the community for a few years before I kind of found pelvic physiotherapy, and I've been doing that for the past several years. I'm also a mom of 4 small children at home. So yeah, I'm a physio, I'm a mom, I'm a woman.
Very cool.
Yeah.
It's a busy lifestyle, but it sounds of it for sure.
Yeah, it is.
Was women's health something that you saw yourself doing right in school as well? Was your passion?
You know, it was always kind of on my radar. Frankly, in physiotherapy school, I think it's a little bit different now, thankfully, but we got about an hour seminar on women's health. And then there was also an elective that you could take, which I did. So it was kind of on my radar, but it wasn't until I had my own experiences going through pregnancy, birth, postpartum recovery, my own experience with pelvic dysfunction, that I kind of found pelvic physiotherapy. And since then, it's become something that I'm really interested in. But I guess it was kind of always on my radar. Yeah, but I didn't pursue it right out of school.
So you were talking about, your experience in the orthopedic field, right? And then there was something that happened that made you make that switch over. Like, was there an event that had happened? Like,
my first birth. It was my first birth, frankly. So I had a very healthy pregnancy with my first one. I was, kind of a young, fit, healthy woman who got pregnant for the first time. For lots of women, frankly, that is their first kind of experience with the kind of medical community outside of just checkups with your doctor and you need medication for an infection or something like that, right? But really, dedicated, scheduled care, and then going in hospital, admitted to hospital. That's lots of times your first experience with it, and it was for me. So I had uncomplicated pregnancy, a relatively uncomplicated birth, just he was really big, and I experienced some pelvic dysfunction after having him and getting back into my regular life, which included working out and physical activity and that kind of stuff. And it's really quite common, way more common than anyone frankly thinks. And it's not something that people are asked about postpartum. And so that is something that I'm working on, kind of trying to change, is change the conversation about, the need for women to get back into really quite intense physical activity when the body is still going through so much in terms of hormonal changes if you're still breastfeeding and you're sleep deprived and all that kind of stuff. So anyways, long story short, I had a big baby. I experienced pelvic dysfunction, and for me it was stress urinary incontinence. So getting back into running and jumping and that kind of stuff, my pelvic floor was not able to keep me dry the whole time. And so I found pelvic physio. I was a patient of pelvic physiotherapy, went through that, was able to rehab, got pregnant again, did the whole thing again, got pregnant again, did the whole thing again. And so yeah, that's kind of the thing that did it for me, was my own experience, and then seeing how it's the same for so many women. But we're frankly not really asked about it and provided with any information on how there is really high quality and high effectiveness treatment for it. Yeah.
Very, very cool.
Yeah.
Like I think that oftentimes our experiences really shape our practice as healthcare providers, right? Because we, it's one thing to empathize, but when you're actually placed in those shoes, right? It's a game changer for sure. You mentioned a little bit about how, women right now are not being asked these questions, right? Like, what would you like to, if you could change the healthcare system to have these questions asked, like how would you change it? Like when would you ask these
so
questions?
so we were talking a little bit about that continuum of care, right? So pregnant women are followed throughout their pregnancy by their birth care provider. So that could be a family doctor, that could be an obstetrician gynecologist, or that could be a midwife. So you're followed through your pregnancy, and then postpartum you have a standard 6-week appointment with that birth care provider, and they ask you a series of questions. For example, how is breastfeeding going? Do you require medical birth control? How is mental health? Because postpartum mental health is a really big deal. Lots of women struggle there. And so what I would change is, just like you're asked all those standard questions, you would also be asked, are you leaking on the way to the bathroom? Are you leaking with coughing, sneezing, laughing? Do you have any sensations of pelvic floor heaviness or pain? Is return to intercourse something that is either you have done and was extremely painful, or you've not done, can't think about doing, there's no possible way that you think that your pelvic floor can accommodate intercourse again. So those are some things that women are struggling with. Their rates are really, really high, and we're not asked about them at all by our medical professionals. And those are topics, frankly, that are not easy to talk about. So women are not going to say, oh, hey, doctor, I'm really having trouble with X, one of those things that I just talked about, because it's embarrassing. And so it really is on the professional to initiate that conversation.
And it's something that you've alluded to for sure in your discussion here, but what role do you think does mental health actually play in dealing with the injury, with the, as you mentioned, some women are embarrassed with the embarrassment, with the pain even that they might be experiencing?
Yeah, it's they're inextricably intertwined, frankly, particularly with birth trauma. So birth trauma can look like a lot of different things. On one end of the spectrum, you can just have, a beautiful birth, frankly, but it wasn't at all what you were expecting. So that could be considered traumatic for some people. On the other end of the spectrum, you can have really quite significant perineal tearing. You can have, you labor for a long time, your baby gets stuck, they use forceps, they use vacuum, still nothing's happening, baby's in distress, mom is in distress, and they take you for an emergency C-section, right? So there's a lot that can happen there, and mental health, and the other statistics that are really interesting, not at all surprising to me, but really interesting, are that urinary incontinence is one of the best predictors of postpartum depression. And And same thing with, back pain for women in their, 40s and 50s. 96, there was kind of a landmark study that was done several years ago. It was a Canadian study that showed that 96% of women with chronic low back pain had pelvic dysfunction. And so we're not putting those together. We're just not looking at people as full human beings. We're looking at them as their mental health, and then we're looking at them as their back pain and as their pelvic dysfunction.
Right.
But it's really all just pieces of the same puzzle.
Yeah.
Mm-hmm.
Like we're looking at it as like individual silos, essentially. Right?
Totally.
What percentage of women, struggle with, who, go through pregnancy, struggle with, pelvic related issues?
Okay, you ready? 1 in 3 women will experience urinary incontinence. That's over the lifetime, so it's not immediately after birth that 1 in 3 women are leaking. That rate, I don't want to get it wrong, but I think it's more about 1 in 7.
Right.
But so what happens is that, it's not just pelvic health and urinary incontinence is not just something that happens once in a lifetime and then you either have it for the rest of your life or you don't. Typically what happens is that, there are risk factors for, I'm talking about urinary incontinence because but there are lots of pelvic dysfunctions, pelvic organ prolapse and sexual pain and vaginismus, that kind of stuff. But with urinary incontinence in particular, kind of 1 in 7 women will experience it after a vaginal delivery. And then you go through your entire life, maybe you struggle a little bit, and then hormones change on you again during menopause, and that little bit of pelvic dysfunction that you had throughout your whole life turns into something completely different. And now maybe you're a surgical candidate when pelvic floor physiotherapy intervention a couple decades earlier could have saved you from what is now your reality. So yeah, the statistics with incontinence is 1 in 3 women. With pelvic organ prolapse, this one is a little bit tricky because just the physiology of a pregnant woman's body and so 1 in 2 women will experience pelvic organ descent, and it's graded differently. We don't have to get into all of that. Only 1 in 5 will probably be symptomatic for pelvic organ prolapse, but that one's a really big deal. So incontinence is one thing, but having your organs descend and not being supported by the pelvic floor from below is something completely different, and that's really quite terrifying for women.
I bet.
75% of pregnant women, I think it's probably closer to 100, frankly, will experience pelvic girdle pain during pregnancy. So pain in the lumbo-pelvic hip complex, and then beyond too, right? We talked about that low back pain being really closely intertwined with pelvic floor dysfunction. So there's that. 75% of women at some point in their life, again, we think we have the numbers right, although we don't do the studies to see are we actually getting the numbers right.
Yeah.
So 75% around there of women will experience pain with consensual intercourse. So, I mean, lots of stuff, and these things can all be really quite effectively managed, treated and cured, frankly, through pelvic physiotherapy. So it's really highly effective and a good treatment option for people.
Yeah, lots of really high numbers there, actually.
High numbers.
Didn't expect it.
Yeah, I know.
And so kind of connecting those numbers with what you do then, in your experience, how effective is the pelvic physiotherapy?
Well, I mean, in my experience, it doesn't really matter, right? In the literature shows that for urinary incontinence, pelvic floor physiotherapy intervention is highly effective. We talk about cure rates. In medicine, for all of the students, the medical professionals who are listening to this, in medicine, we don't often talk about cure rates, right? We talk about managing, we talk about, keeping things under control, that kind of stuff. With pelvic physiotherapy and incontinence, we talk about cure rates. So you can go from leaking to no longer leaking, which is a really big deal, frankly. And rates up in the anywhere from 50, and some studies show over 80%. So that's I mean, and that's worth a shot.
Yeah, absolutely.
And then again, in my experience, it reflects that. It's really quite high.
Gotcha. That's pretty impressive. When we're like as pharmacists, when we're in school, we're always taught about the drug measures to managing symptoms. But like you said, it's not a cure though.
Exactly.
And I think a lot of patients they want something. They want a cure. They don't want to be on a medication forever, right? Earlier going back a little bit. Earlier you were talking about you were saying that you're working on trying to change the system. What sort of projects are you working on to try to facilitate that, both inside your practice and outside of your practice?
So the first one is kind of encouraging women to be autonomous kind of users of the healthcare system, right? So if people are not asking you about your pelvic health, then bring it up, right? Even though it's a little bit of an embarrassing topic, you're talking with your doctor, you're talking with your midwife, they've seen you give birth, right? So they know that your pelvic floor has gone through a little bit of stretch. We'll just leave it at that. So yeah, just encouraging women to be really thoughtful consumers of healthcare, and managing their own symptoms and not waiting for someone to ask about that. So that's number one, and I do that through my practice, just kind of, through conversations with my clients. I also do that a little bit, or I try to anyways, on social media. So there are lots of people who are just not ready for an appointment for whatever reason. But as long as they know that the service is out there, then at some point they may become ready for that. So there's that. And then kind of on the healthcare side, I do have ideas of how I want things to look, how I want things to change. Number one, like I said, I want healthcare providers to ask the questions. Sometimes they don't know what questions to ask. They also don't know what to do with the answers that they might get, right? And so maybe it's just safer not to ask the question. So in the same way, you guys might not know this. So you're followed back to that continuum of care, right? So you're followed by your birth care provider until 6 weeks. Usually if there's nothing else going on at 6 weeks, you're kind of discharged. And women are cleared for return to activity without any guidance, return to intercourse without any guidance, return to all kinds of different things just at 6 weeks. And then the next kind of point of contact with the healthcare system is for your child's immunizations. And so that happens through the public health centers. There are nurses there. I think that would be another appropriate time by a different provider to be asking mom about how they're doing. The focus really shifts away from mom after you have a baby, because there's this brand new newborn baby and we have to make sure they're healthy and thriving and that kind of stuff. And so mom just really takes the back seat. But yeah, that point of contact would be another good one. And at that 8-week appointment, so your baby's first immunization, you're handed a questionnaire to fill out about mental health. And so what I would love to see is you're also handed a questionnaire about your pelvic health. So that's what I'm trying to work on right now. I'm finding lots of barriers to getting something like that implemented. But yeah, that is the change that I would like to see. And even if the doctors don't know, or the midwives or the nurses or whoever doesn't know what questions to ask, then here you have this questionnaire. And if you don't know what to do with the answers, well, the answer is talk to a pelvic physiotherapist, because they can guide you in the right direction. Yeah.
Very cool. So Jill, you obviously have 4 kids, which is a lot on its own.
Yeah, it's a lot of kids.
your practice and you're heavily involved in trying to change the way that the healthcare system works, and in order to help this population that you're so passionate about.
Mm-hmm.
How do you find the time to manage all those things? What does a day-to-day look like for you?
It's a struggle. So I'm currently technically still on a maternity leave right now. I have a 7-month-old at home. He's just about 7 months old. And so I'm using this time where my clinic duties are really quite low. Like I'll just go in to see some patients who've been on my caseload for a long time who just won't see anyone else. So yeah, I'll go into the clinic probably for a few hours every week right now. And then I'm using all of my other time to be a mom and take care of all of my, dropping kids off at school and getting my kids ready for this and taking them to, whatever activity. So yeah, I do try to carve out as much time where I'm not working and just being present with my kids. That's really important. And then the really cool thing about finding something that you're passionate about within your profession is that all of the things that seem like a lot of work, you're not struggling through. You're just trying to make as much headway as you possibly can. It's an exciting kind of work. It doesn't seem like a monotonous studying in school for exams kind of work. So I mean, the way I juggle it is I try to set aside my home time, and then when I'm at work, I can actually work on all of these things. When in January, I'll go back to, it's December right now. In January, when I go back to clinic, I'll go back still part-time. So it will just be 2 evenings a week is what I'll start with. And I can just be there doing my clinic work, and then when I'm at home, I'm just at home. So it's just scheduling, and it's just trying to figure out the childcare piece is another really big one for moms when they return to work. Thankfully, we have family, and we have a pretty regular babysitter who helps with the kids. But yeah, it's a struggle. It's a juggle for sure. But like I said, when you find something in your work that you want to keep pursuing and you want to keep doing, it doesn't seem like, oh, I have to go to work today. It's a little bit of a different focus. And so I encourage people to find that, ideally within what you're already trained to do, because that just makes it easier, right? But if you hate your job, you're gonna, why stay in something that you absolutely loathe? Because that's just death by a million cuts, right? So I would encourage people to find what it is that kind of lights that fire underneath them. And gives them the energy to keep going.
Do you have any advice though for young professionals that are still looking for that passion?
Yeah, that's
still
a good
haven't
question.
quite found it.
So the really tricky thing about healthcare professionals is that you're usually like a bright person who's done well at school and who's just gone through your whole, like you did well in high school and you got good grades, and you went into university and you got good grades, and then you found yourself all of a sudden in a professional program that you had the grades to get into, and you're like, oh, but I don't know if this is actually what I want to do, right? So I would encourage young people who are just kind of starting out to reflect back maybe and think about, what is it throughout my whole life, not just what have I been able to achieve academically, but what is it that I like doing, and if that has to do with healthcare, great. If it has to do with birds, then maybe you're not pursuing the right thing. So I always, and I tell this to my young kids too, is like, you're going to learn the best when you are doing something that you love, right? You will learn so many things by going out in nature, and again, looking at birds and animals and that kind of stuff, right? So it doesn't all have to be on this kind of conveyor belt that we're all on. So yeah, I would just get out there, try different things, expose yourself to as many different things as possible. And the things that are easy for you, and the things that are fun for you, and the things that you like doing, the universe is trying to push you in that direction. The things that are just like, oh my gosh, I cannot. I had courses like that in university for sure, right? Yeah. Where it's just like pulling teeth. And again, the universe is trying to steer you away from that. You're not good, like you're not naturally good at it. So don't spend your whole life in things that you're not naturally, you might, like, just because you're a smart person, you might go through it and you might get the A that you need, but that doesn't mean that you like it. So get out and get out as young as you can, to be able to find that thing that you can move forward with so much passion and enjoyment.
I should really like what you mentioned there with the conveyor belt.
Yeah.
Because honestly, I think a lot of young people, I'd say partially including myself, you've taken that step, you got on the conveyor belt, you got into university, now an opportunity comes up to get into a professional school. You do that, now an opportunity comes to this high-paying job somewhere, let's do that without ever stopping, without getting off and taking a look whether or not this is what you want to do.
Totally, and then before you know it, you're 50 years old. And sure, you have a nice house, you have your kids, but now your kids are on the conveyor belt, right? So being a parent has really kind of, being a parent and also having my own practice and I've been fortunate enough to find something within my, like the profession that I was already in, that gives me that fire, which I think is really fortunate. But yeah, now I'm trying to think with my kids, how can I make sure that they don't end up in the factory?
Absolutely. And you mentioned an interesting thing before, and this goes back to, just having a lot of things on the go with a lot of kids. And earlier we were talking about the importance of mental health, right? How do you make sure that you, like, while all of these things are happening, how do you make sure that you keep your mental health in check?
Excellent question. This is a big one for me because it's just so prevalent in the population that I treat mostly in my practice, which is this perinatal. So just basic self-care for women, for new moms who are in charge of, the daily activities, the basic bodily functions, everything of their kids, right? It can be really easy to say, I have to spend all of my energy, all of my everything, pour myself into this without taking a step back and realizing that the best thing that I can do for my kids is be healthy myself. One of the very best predictors of kind of family well-being is the mental health, physical wellness of the mom. So I really try to encourage women to just at a very basic level get enough sleep, which is difficult when you're up breastfeeding all night. So get enough sleep. Drink lots of water is really important for your pelvic health. Eat good food. Get some sunshine in your life. Go out and be in nature. Find a community. So isolation is a really big one, especially in our northern winters. If you have a baby in like December, it can be really hard to achieve all of those things. So just really basic self-care stuff is what I tell all of my exercise is, you know, a really big one, frankly. And so all of that kind of stuff I try to encourage my patients to do, and then I also try to take that advice myself. So that's honestly how I take care of myself mentally, is just try to hit as many of those basic needs as possible, and anything beyond that, like a grocery store trip by yourself, that's just bonus.
You know what? It's interesting that you bring that up. You know, as I think often as healthcare providers, we're so good at giving advice, but we're terrible at taking our own advice.
Oh, totally.
I wanted to switch gears a little bit here, and you know, again, it's sort of on the topic of just having a lot of things on the go. One of the common trends that I know for sure that I've personally experienced as well too, is that, you know, you not only have kids, you have a significant other, and all these things are happening, right? How do you ensure that you can still find time for to spend with your significant other, spend time with the family, right? Like how do you find that balance? Or like what are some things that you practice and that you really live by?
Number one is changing mindset. So in the beginning, when we just had one kid, it was easy to kind of carve out some time just to spend with your significant other. And although I think that's really important, the more kids you have, the more infrequent that becomes. And so frankly, what I've tried to do, and this is just what has worked for me, maybe for people who don't have as many kids, they can actually still carve out that time. But you know, I kind of had kids for a reason. And so I had kids not to, you know, take time away from them. I'm already doing that at work, and I'm already doing that with, you know, just taking care of myself. And so those times that and not to say that we don't ever do things just by ourselves, right? But those times where you would have just gone out for dinner only with your significant other, maybe you do something as a family, so that quality time, because again, so I work clinically part-time. I have my administrative duties, and then I also have my home duties. My husband is in a kind of corporate job where he works all day and then is home just for, you know, a small amount of our kids' waking hours. And so why would we take some of that time away to just go do something by ourselves when we could use that time to be together as a family? So changing mindset, and this is just a season of our lives, and the seasons will change again. Our kids will not need us so intensely as they do right now. Like my oldest one is 5 and my youngest one is 7 months. And so they won't need us in the same way. I mean, they probably won't want to be around us when they're teenagers, and so we'll have time to do whatever we want.
You're looking forward.
Yeah.
No, absolutely. I guess like when you first opened up your practice, right? Was that a big learning curve for you when like to start up a startup operation is obviously quite challenging in itself, right? And I just kind of want to better understand the timeline here. Like, did you have your first kid by?
Oh, sure, yeah. So the timeline for me was that I graduated physiotherapy school in 2010. I worked as an orthopedic physiotherapist until my first child was born in 2013. I took some time off, and on that maternity leave, that's when I was kind of struggling through my own things, and so I was doing my own self-study and, you know, being a patient of physiotherapy myself in that time. Then when I went back to work, I did go back to work with kind of a lens of women's health, but I hadn't transitioned over yet. So then I worked for another couple of years until I had my twins. Then when I had them, I took all of the necessary postgraduate education and courses to be a full pelvic physiotherapist. And so when I returned to work, then I had transitioned my practice completely over, and have been working as a pelvic physio since then. So it's been a few years now. although, like I said, I was still treating with a lens of women's health and pelvic physio before that. I didn't kind of transition my practice completely over until 2015. So yeah, and then after, it really sounds silly when I say like, oh yeah, in 2015 I was on maternity leave with my twins, I was taking all these courses, I was, building a business. But again, when you find the thing that just drives you, it doesn't seem like work in the same way. It feels like just the logical next step. There are some obstacles, if you want to call that, needed to overcome to be able to get to that point. But it doesn't feel like work. It just feels like, oh, now I get to go take this course. And oh, now I get to learn about, different EMR, like electronic medical records system, right? So I get to kind of research what is it that I want to have in my practice here. And oh, now I get to learn about kind of all the back end stuff with business. So it was really quite fun. Of course, there was stress involved with it, but again, when you kind of find those things that just kind of set your soul on fire, it's really easy to do the work. Yeah.
Clearly you love what you do, and it drives you every day by the sounds of it. I'm actually kind of curious about the other side of things in terms of, obviously you see women that may have struggled for weeks, months, or even years. Do you ever find, does it ever frustrate you when they come in and they haven't been able to get help, or they never actually access the healthcare system?
Yes, there are some times where I go like, why didn't why hasn't anyone asked you about this? I get it though, right? Like I get where our medical system kind of is right now. It's trending in a positive direction, and so I'm kind of happy about that. But yeah, there are some. We mentioned pelvic organ prolapse earlier in the conversation, and so particularly where the organs have just come down now, where a pessary is not going to do it, or just kind of strengthening up the muscles from below are not going to do it. We're actually now in kind of a surgical situation, and the failure rates for gynecological surgery are really high. Like 1 in 3 will fail. So it's so yeah, when I get women and I'm like, if only, right? If only someone. So yes, there is some frustration involved with it, but you just have to meet people where they are and say, okay, this is the lay of the land, and this is how we move forward, and we're going to do whatever we can possible to make sure that you're not one of those failure surgeries, and we just take it as we can.
And then I think as healthcare professionals, and then you've kind of mentioned this as well, but we all kind of hit that point sometimes where there's only so much we can do for an individual. And then I think in our profession as well, that we can see that sometimes we've exhausted all medical measures and all of other measures that we can think of. And then we feel quite helpless at this point. Have you ever gotten to that point with a patient where you've exhausted all measures and things are still not getting better?
Yeah, the really cool thing about physio in general, pelvic physio maybe even a little bit more so, is that there are some things that I can do that are going to help your situation, but there's not like this whole big toolkit of things that I can do to you that are going to make your life better. Really, it's about, okay, here are the steps that you can take. Here are the things that, from listening to you and from seeing your body and from feeling your pelvis and your pelvic floor, here are the things that I think can be working better. Here's how you can get them working better. You got to do it, So there was one of my mentors gave me this really great analogy. My job is really just to point the flashlight in the direction that you need to go, and your job is to walk that way. When I see you over on this on this trajectory, and you're you know, it's so hard when you're living in it sometimes, and you know, symptoms are just kind of swirling around you and you feel like you're helpless. It can be really helpful to have someone just sit down with you and listen to your story, which doesn't often happen in a 6-minute medical doctor's office or with a very short conversation with whoever. But if you have the opportunity to really listen to someone's story and kind of pick out like, oh, well, you said this, do you realize how this and this symptom are correlated? And then, oh, actually, no, I didn't ever. And so that's just kind of like, okay, well, then instead of walking this way, why don't you walk this way? And they're like, okay, sure. And then really they own their recovery in that way. And it can be really kind of life-changing for people. So yes, although I do get really frustrated sometimes, and again, we talked about seasons of life for new moms, it's the reality of it is sometimes that you might not have the opportunity to dedicate a lot of time and energy and effort and resources into what you need to be doing. So I try to give people just as much information as they can tolerate at that time. And they can make small steps, they can make giant leaps, they can do whatever they can. I mean, they really are in charge.
You empower them to do things.
Exactly.
They have to take that extra step.
Exactly. Yeah.
Thank you. You know, one of the things, I guess, like, you know, you talked about pointing the flashlight in one direction. Just to wrap things up here, I wanted to make sure that we had the time to touch on, you know, one of the, I guess one thing that you would want to make sure that, you know, our audience is able to really take away from this, and one thing that is just really, really fundamentally important to you, that you just want the audience to learn, to be able to, and it could be to point them in one direction, or it could just be a general piece of life advice. It may not even be health related.
It's going to be clinical. So, here's the thing, is that lots of times, the majority of the time, people, if they do get the courage to say like, listen, I am experiencing this stuff, or their doctor has, doctor or whatever healthcare provider has said, you know, are you dealing with this stuff? Usually the recommendation is, okay, we'll go home and work on your pelvic floor, do some Kegels, do some contractions. The research is really quite clear in saying that with verbal instruction alone, or with like reading it on the internet or whatever. The internet is terrible, by the way, particularly for the pelvic organ prolapse group, because you just see these pictures and they're terrifying, and all of the advice out there is there's no hope, you're gonna need surgery, just go do it now. And so just don't listen to that, just go see your friendly neighborhood pelvic physio. But with verbal instruction alone, the majority of people are not doing, men and women, everyone has a pelvic floor, the majority of people are not doing a pelvic floor contraction correctly. And so you go home and you're doing 100 of the wrong exercise, well, that's not gonna help the situation, right? So a pelvic floor contraction, everybody, is when you are trying to stop gas from coming out, you're trying to stop urine from coming out, it's not a bum squeeze, it's not squeezing your knees together, it's not an abdominal contraction, it's also not bearing down, it's a whole bunch of, it's none of those, it's a closure and a lift. If you can't feel the closure and you can't feel the lift, you might need someone to help you figure out how to do that contraction a little bit better. Because again, you're not going to stop urine coming out by clenching your bum, and you're not going to stop gas from coming out by squeezing your knees together. I mean, just keep your eyes open now for all of the women in your life, men too. Here's the thing, is that with as much as passionate as I am about pelvic health and women's health in general, the state of affairs for men's pelvic health is even further behind. So the number of men, frankly, who, go through prostatectomy and have their own struggles. There are very few women's pelvic health practitioners. There are far less pelvic physiotherapists who specialize in men's health. And so post-prostatectomy and other things, surgeries and just injuries in general, men are left with really quite debilitating incontinence of urine and feces sometimes, sexual dysfunction, which can be, again, we talked about mental health, but that can be a really big issue for men throughout the lifespan, sometimes in young middle age, and then even older people are still sexually active, and that's a big part of who they are. So yeah, men and women, everyone has a pelvic floor. If you're not able to close and lift, and just as importantly, let go of the pelvic floor too, so you can't be living your life at 100 up here, that comes with its own problems. So then you also have to feel the down and out portion. If that is difficult for you, then I highly recommend an appointment with a physiotherapist.
Thank you. Thank you for that. It's so amazing to see someone so passionate about this niche that's truly impacting many people's lives.
Yeah, you betcha.
Where can of course, some of our audience may have questions. Where can they reach you? Where's your clinic located? Do you have social media pages that they can follow you at? Can you share that?
Yeah, you betcha. So my clinic is located in South Edmonton. We were talking a little bit before this conversation. My practice in the new year is going to be morphing into something a little bit different. So although I have my bounce back physiotherapy practice right now, it's actually going to be incorporated into a larger umbrella called Pine Integrated Health Center, where we'll have, where patients who come to Pine will have access to pelvic physiotherapy and psychology and massage and acupuncture and fitness and all of that kind of under one roof, because part of the problem is that A, you don't know that these services exist and can help you, and B, even if you do know they exist, well, where do you go to find them? So we're trying to address those issues by bringing things under one roof. On social media, so that's also going to be located in South Edmonton. On social media, you can find me. I am YEG Pelvic Physio on Instagram. On Facebook, I'm Bounce Back Physical Therapy. My website is bouncebackphysio.ca, and I have a little blog up there with some topics when I have 10 minutes to write something. But yeah, that's kind of where you can find me.
Excellent. We really appreciate your time. I think we, as well as our listeners, I'm sure have learned a lot.
Great.
Actually, a lot of surprising things have come out, I think, out of this conversation as well.
Great, I'm glad.
Really appreciate your time. And that's it.
Okay.
Thank you.
Yeah, you're welcome.
Hey guys, I hope you really enjoyed this interview. One of the most important takeaways from this is, really finding your passion. Jill talks about how that you've been able to find your passion when work no longer feels like work. She also talks about the importance of not falling victim towards becoming content and, getting stuck on this conveyor belt and just, going through the motions. But I think the most important takeaway from this is the importance of upkeeping your mental health. Even though you may be pursuing all these different ambitions, all these different projects, you still need to exercise, you still got to eat healthy, and you still got to surround yourself with a positive support group. That's it, guys. Really hope you guys enjoyed this interview. I know we did for sure. If you enjoyed it, please subscribe. Let us know in the comments below, what sort of other interviews, what sort of other healthcare practitioners you would like to see. And we look forward to hearing from you soon.